Hi, I'm Dr. Dennis Weigel, Heartland Orthopedics. I've been with the Heartland Orthopedic Group now for 20 years. I am one of the arthroplasty surgeons, and one of my specialties does include hip and knee arthritis treatment. And I'm going to spend a little time today talking about arthritis, particularly focusing on osteoarthritis and the various treatment options associated with it. This is part 3 in our series that my partners, Dr. Nelson, I did a talk on shoulder treatment conditions, and Dr. Feierabend gave a talk on robotic arthroplasty. Our group, Heartland Orthopedics, does provide the gamut of orthopedic care ranging from joint replacement, sports medicine. We do provide physical therapy, upper extremity care, hip and knee care, foot and ankle, neuromuscular, and spine and neuromuscular care. Joint health is very important. Our joints affect almost everything that we do, and bad joints severely limit our ability to move and work. We'll be talking about osteoarthritis today, which is the most common type of arthritis we see in the orthopedic clinic. It's known as degenerative arthritis and affects 27 million Americans and projected to affect 60 million by 2030. It is a wear and tear condition that develops slowly over time, resulting from overuse, injury, and repetitive use. Developmental disorders of the joint, particularly of the hip, will result in this as well. The end result is pain, stiffness, and immobility. The symptoms of osteoarthritis will include warmth of the joint, swelling, pain and immobility, joint stiffness, decreased activity, impaired lifestyle, and joint deformities. It's very important to get a proper diagnosis. We start with a medical history, which includes symptoms. Has there been any injury that's occurred? We'll take the person's overall health status into account and their activities and activity goals. Very important to get an exam of the affected extremity to include the joint above and below. This includes strength and neuromuscular testing. And then we'll go on to imaging, which most of the time will include plain x-rays. Occasionally, in situations that might be radiographs would be inconclusive, we will then move on to a CT scan or an MRI. As you can see here, this is a radiograph of the knee. On the left, this is a normal knee. You can see the gray area between the bones. That represents the cartilage. We like symmetry in orthopedics, and most joints are symmetric in a normal situation. You can see on the inside and the outside area of the joint that the thickness is the same. Now, if you move over to the radiographs on the right, the space on the right-hand side of the radiograph is bone on bone. There is no joint space. There are also increased areas of bone deposition called bone spurs, and the bone is a little more white, resulting from the stresses that the joint is seeing. This is a radiograph of a hip, and once again on the left, this is a normal hip. You can see the joint space there. That represents the cartilage cap. The cartilage cap is kind of like the white glistening stuff on the end of the chicken bone, and this is what you lose with arthritis. On the right-hand side there, you will see loss of joint space. The radiograph appears to be a little more white. That, once again, is resulting from increased bone deposition from the stresses that the joint is seeing because of the loss of cartilage. Non-surgical treatment options can be very effective. These include walking aids, heat and cold therapy, which provide relief for the symptomatic hip or knee. Physical therapy can lessen the pain by teaching better posture form for day-to-day activities such as getting in and out of a chair. And over-the-counter medications and prescription medications can reduce pain and swelling. These include the anti-inflammatories such as ibuprofen, steroid injections will be used, and corticosteroids as well. When should you consider joint replacement? Well, there are a few questions to ask. First of all, is the joint affecting your ability to get a good night's sleep? Does the joint pain keep you from doing things that you want to do? Have you tried all the non-operative options? Has this curtailed your activity because of the joint pain? And have you discussed it with an orthopedic surgeon? The benefits of joint replacement. Joint replacement is one of the more successful procedures across the field of medicine. It does a wonderful job of reducing or eliminating pain in the affected joint. The whole goal is to improve mobility, and it does a wonderful job of improving mobility and restoring movement. and it does a wonderful job as well as improving quality of life. And the goal is to return people to a normal activity level, including low-impact activities such as golf and tennis and whatnot. Now, this shows a diagram of or a model of a knee replacement on the left and a radiograph of a knee replacement. So what we do in a knee replacement is we are resurfacing the joint. We put a metal piece on the end of the femur that replicates the normal anatomy. And on the tibia, or the bottom part of the joint, we put a metal and plastic tray. And on the x-ray there on the right, you can see that clear space between the two white metal surfaces, and that is the new joint space. People sometimes ask, do I get a new kneecap? Well, yes and no. You retain your kneecap, but there is a new button that goes on the backside that is also clear on this x-ray. Hip replacement, similar concept. We will utilize a metal shell that fits into the pelvis that the bone actually grows into. And in that shell, there is a bearing surface that will fit into that. And then that bearing surface, whether it is plastic or ceramic, will then articulate with a ball that may be a metal ball or a ceramic ball. And that ball then fits on a stem that goes down the thigh bone. Typically, these stems are made of titanium, but occasionally we will use a cemented stem in older patients with poor bone quality. Risks and complications of arthroplasty include infection. Although it's very unusual, when it does happen, it can be a big problem. Blood clots, loosening, and premature wear. Heartland Orthopedics and Alexandria Health is a member of the American Joint Registry and continues to be designated as a center of distinction by Blue Cross and Blue Shield for hip and knee replacement based on patient outcomes and cost efficiencies. Delivering exceptional patient experience focuses on the entire patient experience from pre to post-surgery. 99.3% of all joint replacement patients have rated their hospital stay and experience with the program as very good or excellent. Our office locations include Alexandria, the Wilmer area, Morris, Graceville, Wadena, and Fergus Falls. In closing, a proper diagnosis is important to identify the cause of the joint pain. Arthritis can be controlled, and many non-operative treatment options are available. Joint replacement is a successful option when non-operative treatments fail, and we are very excited to be the first in the region to offer the highly advanced robotic-assisted technology in Alexandria. Thank you.